dosing and schedule. So the one thing that I've learned is that LDN, low dose naltrexone, is an evolving space in medicine. So if you think the second you think, oh, it's something that's fixed and this is exactly what you do this X, Y, Z, you can like boilerplate it. You can't. It keeps on moving. It keeps on expanding. It keeps on changing. You find new applications, different ways of giving it. So used to be that once a day was the dose. QD is once a day, but now we're seeing twice a day or even sometimes 3 times a day. We see asymmetric dosing, like that last patient, 4 milligrams in the afternoon, in the evening, and we're talking about a 0.5 milligram in the morning. Patience is key. I said this before, and we'll keep on stressing it. 6 months is not unusual, but 2 to 3 months is typical. And just remember, most people have had their patients. Most patients have had their diseases for years. So if you talk to them, or if the doctors have to be aware that it's going to require some time to speak and to educate. And also patients have to understand that, the same way from the other way around, that the doctors sometimes don't know about this. It's going to require them to educate their doctors. Look it up, get the papers, send them to the doctor, bring them to the doctor. Bother the doctor gently again and again and again. Don't be like in your face, but just like, hey doc, and then hey doc, and finally it's like, okay, let me look at these papers.
And if you can see, we say that it's like we said it's like 2 micrograms up to 8 milligrams, and now I'm sure Dr. Goldstein would agree. We have patients on 12 milligrams. We have patients on 8 milligrams. 3 times a day. But just to give you the mantra used to be 1.5, 3, 4.5. And that's where they would maybe hit 50% of the people would get relief, but you'd miss a lot of people. And what we found now, that range of that 1.5 milligrams to 4.5, you can see now I have 2 micrograms up to 8 milligrams. To put it into perspective, 8 milligrams is 8,000 micrograms. So now all of a sudden we went from 1.5 milligrams to 4.5 milligrams, and we stretched the range of the dosing from 2 micrograms to 8,000 micrograms or 12,000 micrograms. So just trying to let people know that you really need, a pharmacy that's well-versed in this, as well as a practitioner that's well-versed in this, to understand the nuances of the dosing. And these are the titration kits that we came up with. So originally we started the titration at like 1.5 milligram, and we have the kit all set up. It's very nice and easy. It's color-coded. We have 0.5 and 1.5 milligram capsules in the kit. You start with, once a week, you can increase those capsules. You start with the 0.5, then you go to 2, then 2.5, and so on. And then as we both got more experience with this, it's actually Dr. Goldstein had come up with like maybe we need to start at 0.5. So we came up with a second kit. We call it the lower dose titration kit. First, we called it the senior kit because we thought only older people have to start, lower. And then we thought, well, that's not nice to just call old people, So we changed the name to the lower dose kit, makes it a little easier. But I mean, again, you could start with either. And I can tell you, like, I have some people who are very, very sensitive that sometimes we have to start them on 100 micrograms. So, not to say that it has to be this or this. Again, that's going back to that individualized dosage. And the main thing, though, is like we said, once you get on the drug, and you've achieved your dosage, like he said, he had that patient that the dose was 0.5, or a patient that the dose was 4. Then, as a compounding pharmacy, then we just make that 1 capsule in that 1 strength. And then at the point of you're not having a kit where you're changing all these dosages. And typically, you're on that, you're probably going to be on it for life. And, like a 90-day supply is like $65. I think when I first met Dr. Goldstein and we were at a seminar together with a bunch of practitioners, and we were talking about that. And he was first, I think maybe he was a little hesitant, and then he was starting to like, oh, this is interesting, and seeing all the companies. And he had asked me, well, how much does this cost? Because everybody thinks that compounds are so expensive. And I told him, oh, like $65 for 90-day supply. He's like, okay, I'm sold, I'm in, because people just think compounds are expensive. But reality, we really we believe in this therapy. And we know that, another friend of ours, Dr. Donna, he had told me a lot of his patients, again, they're chronic pain, but they have to pay out of pocket. A lot of them aren't working, it's a hardship. So again, if we could, at $65 for a 90-day supply, it tends to be like cheaper than a lot of people's copay, for like a month's supply on most drugs.